My name is Don Christensen. In January of 2019, my right Achilles tendon started to hurt, and around the same time, my left shoulder started to hurt. I have a fairly high pain threshold, so I'm able to ignore a lot of pain, but I started on a program to try and alleviate the issue, and that included deep tissue massage, acupuncture, physiotherapy, and nothing gave me any long-term results. In June of 2019, the Achilles tendon started to throb, pretty much 7/24. Back started to spasm in September of 2019. In talking to my doctor at that time, he told me that he said, maybe the issue is your fascia. And he told me at that time, he said the medical profession has, and the periphery for that matter, chiropractors and the physiotherapists, have spent their lifetime trying to focus on bones and muscle and tissue and that sort of thing. He said they've ignored the fascia. The fascia was something that they cut out of the way to get down to where they really wanted to study, and that was muscles and bones. So he said to me, there's an outfit in Phoenix that focuses on fascia. And he said, I know you're going there for the winter, so maybe you should go and see them. So I took a look at your website and liked what I read in there. For one of the big things on the website that caught my attention was that it stated in there, we don't look at the area that is hurting, we look at the entire body to try and ascertain whether or not the root cause is the area of the pain or whether the area that is hurting is actually just manifesting itself in that area. I like that approach. So I approached you in late October, early November, and we started the program, which the first 10 sessions ended in actually on Christmas Eve. The Achilles tendon stopped throbbing after the third session. After the fifth session, the Achilles tendon no longer hurt, the left shoulder no longer hurt, and so I'm a believer. It's been great. Well, I would talk to anybody who's having some issues with knees, backs, nagging injuries that they may have resigned themselves to the fact that they were going to have to live with them. I had pretty much decided that the issues I had starting last January were probably based in the fact that I was 68 years old, and getting old, that's just life. You're going to have to deal with it. And I've now found that not the case. So there are things that you can do to try and rectify it. It's certainly, I'm not going to say that what worked for me is going to work for everybody, but at least you need to try. Well, I think just my overall feeling of well-being. I've been fairly athletic all of my life. I've been, in my earlier years, I was a jock. And what I found is that I'm regaining my mobility and my flexibility. And it's been particularly good for me because I still golf quite avidly, and it's actually made a real difference for my swing in that I'm now able to rotate through the swing, and I actually feel better when I am swinging now. My doctor is a rather progressive doctor in that he looks for alternatives. His statement to me was that he had asked me to report back to him on any successes that I had when I worked with Sterling structural therapy, if I decided to go that route, simply because he is looking for alternatives to drugs and opiates to try to assist with pain management, alleviate pain management. And I have been sending reports back to him identifying the successes that I've had, and hopefully we'll be able to maybe change some attitudes within the medical profession and get them to possibly look at this type of therapy to try and assist their patients. I would recommend that if you're having issues and none of the other professions seem to be able to deal with it, then approach Sterling Structural Therapy and see if possibly they can find the issues and maybe help to rectify the issues for you.